This procedure is recommended as a treatment option because I believe it is the best option for erectile dysfunction treatment. As I mentioned earlier, all the other treatments available besides a penile implant are subpar. They do not rise to the level of satisfaction that this implant will give you. They also have, we're talking about side effects of implant surgery, the risks of risks associated with the penile injections and of the pills are even greater. You come to the facility, they get you ready, you put your IV in your arm, you get some antibiotics intravenously, we take you to the room, you are put to sleep on the table, we shave you, we clean thoroughly, and then we proceed with the actual surgical procedure whereby you make that incision that I described earlier, just above the pubic bone, and then we make the dissection down and then place the components of the implant. Then we close you up, we put a drain in before we close you up, and then we wake you up, we take you back to the recovery room. And after a couple of hours in the recovery room, you go home and you're done. Typical stay is approximately 4 to 6 hours. That is from the time you walk into the facility to the time you leave and go back home. That will depend. There are some individuals who do not need any clearance at all if you do not have any medical problems. You are not diabetic, you don't have any heart disease, you don't have any high blood pressure. You don't necessarily require any clearance. However, obviously, if you do have any of these other issues, other medical problems, then we will ask your primary care doctor or your cardiologist or endocrinologist to give us clearance. So it all depends. Absolutely. You may be able to drive yourself to the facility, but you cannot drive home. And it's best, we require you actually to have someone to drive you home. This again will depend on the surgeon, but for me, I do not require any particular instructions before the surgery. Once you are in the preoperative holding area, that's when we prepare you. Again, like I said, you're gonna get an IV, we're gonna take you to the room, we're gonna shave you, and we're gonna wash you thoroughly with different preparations that we believe cuts down the bacteria on the skin significantly. And then we also give you intravenous antibiotics before we proceed to start the surgery. The most important medication that one may be taking that we ask that you stop anticoagulants, antiplatelets such as aspirin, Plavix, Coumadin, and the like. Other than that, you can take your blood pressure medication with a little bit of sip of water, just a little bit, in order to keep your blood pressure in check. For people who are diabetics, you cannot take your medication because, again, you're not going to be eating anything the night before, so you don't want your sugar to be too low. So if you're diabetic, you don't need to take your medication, but people with blood pressure, high blood pressure, need their medications. Yeah, I just went over this briefly. Eating or drinking restrictions. Yes, on the midnight before the day of the surgery, you cannot eat or drink anything. That's pretty much it. Essentially, your ID and insurance card. Any valuables that you may have, we advise that you leave those at home. I do not advise my patients to shave before surgery. We do the shaving for you in the preoperative holding area before we take you to the operating room to do the shaving, to do the surgery. So no, we don't ask that you shave before the surgery. but we're gonna shave you once you are in the facility. Again, you come into the facility, we take you to where we call the pre-operative holding area. You'll be attended to by nurses who will get your registration going. Once you're registered, we take you to the area, and you're gonna get an IV placed in your arm, and then we start the IV antibiotics, and then we roll you into the operating room. Once you are there, the anesthesiologist will put you to sleep, and then you'll be shaved, as I mentioned earlier. We wash you thoroughly with different chemical agents, and basically that's it. By the time you wake up, the surgery will be over. You'll be in the recovery room, because once you go to sleep, we start the surgery, we're done, and then we take you back to recovery. So you wake up in the recovery room, you stay there for a little bit, maybe a couple of hours. Make sure that your pain is well controlled, you are fully awake. We get you something to eat, and then we get you up, you walk a little bit to make sure that you are steady before we send you going home. Nervousness about the procedure, that is not unusual. It is common. It's actually a normal reaction. If you're not nervous, that might not be a good thing. So just relax. I know it's easy for me to say, but try to relax as much as possible. You are in good hands. We're going to take good care of you, and you'll be fine. So just relax, and being nervous is always not normal. You can always call me. Call my office. I'll be available to talk to you. And that's the person you want to really talk to. You don't want to talk to anybody else. And generally, if you call, and I know you're gonna, my staff knows that you're gonna have this procedure done, they're gonna get me on the phone with you. So yes, I'm available to talk to you anytime you have any questions regarding your treatment.